My name is Dr. Scott Stine. I'm a family practice physician. I've been here in Vincennes for about 18 years. I'm also the Chief Medical Officer of Good Samaritan Physician Network. So I'm trained as a family practice physician. Did a residency in Muncie, Indiana. I'm trained pretty much for broad spectrum family practice. For about the first 16 years of my career here, I did obstetrics as well. I stopped doing that a couple of years ago. But I pretty much practice what we call cradle to grave care. So deliver babies and take care of babies, and adolescent medicine and adult medicine and geriatric medicine. And then I do a lot of procedural type things. When I was in residency, I identified that I really enjoyed doing procedural type skills. So office-based procedures like skin cancer surgeries, and vasectomies, and birth control procedures, and then some aesthetic dermatology as well. And so I do a lot of that in the office also, as well as some gastroenterology procedures like colonoscopy and EGD. I knew pretty early on that I wanted to do primary care medicine because there's never a boring day. I can say certainly the best part about my job is every day is something new, every day is something interesting. I can't ever remember a boring day at work over the course of the past 23 years. There's always something every day that will challenge me, something that I don't know that I need to look further into, and that's always been the appeal of primary care is that it's always interesting. The other big deal with primary care is we focus a lot on prevention. And really, our best money spent and our best efforts in medicine are to try to prevent diseases before they occur. And so that's been the big appeal to me as far as primary care. Well, the thing that I hope people remember the most about visits when they come to see me is that we focus specifically on them and then have what we call shared decision making about their healthcare. I have told people for many years, and it's on my online profile now, that I am a lead a horse to water kind of person. I want people to be involved in the choices that they make. People have a whole variety of different perspectives on their own healthcare, what they want to do and what they don't want to do. I don't shove things down people's throats. I want them to know what's recommended in medicine. I want them to understand what the best thing to do is. And then if they say, that's not necessarily what I'm interested in, but I'll kind of meet you halfway, or we can talk about what the options are. I hope that they go away from a visit with me understanding that what I want is what's best for them and their health and their family's health. But I don't judge people based on the decisions that they make. What I love most about the Good Samaritan Hospital is the medical staff that we have. I think we have a wonderful facility, but really what makes it special are the people that I work with, my colleagues here in the office and my colleagues at the hospital. Wow, books that have had a major impact. I read a book many, many years ago by Chuck Yeager, and that had a big impact on me. I've been interested in aviation most of my life, and a lot of the things that I took away from his book I've applied to my life over the years, and that was one of the early things that interested me in aviation. In my free time, I like to hang out with my family and fly airplanes. I've been lucky enough to be married and have 5 kids, and they're all daughters. And my wife has been extremely patient and a great example for all of us. And in the time that I have away from them and with them, I like to play with airplanes, and that is big airplanes. So I have a pilot's license. I fly private pilot, and then I also fly model airplanes as well. If I were to have my own billboard up, what would I have it say? I think the main thing that I would want people to think about as they are driving along is having pride in themselves and self-respect. I think one of the things that has kind of degraded in our society over the years is people don't have as much self-respect as they should. They don't take pride in themselves. There's a lot of self-doubt in today's society. I think people should be proud of who they are and what they are and what they want to do. And unfortunately, when that gets degraded, it really inhibits people's ability to live up to what their potential could be.